Hello, welcome to Unit 2 of Introduction to Public Health, and today we're going to define the term public health. Okay? So public health has actually been defined by different authors, and I have quoted some of the authors, such as Parks 2007. They define public health as a science of protecting and improving the health of communities through education, promoting of health lifestyles, and also research for disease and injury prevention. So the most significant aspect here is it's done through organized community effort. Then another definition is by Winslow, 1920. He defined public health as a science and art of preventing disease, prolonging life, promoting health and efficiency through organized community effort. So you can see community effort is actually a key thing when you're doing public health. So whatever you're doing for the good of the community, it should aim at preventing disease and improving their health at large. Then we have Bingo Ho. He also defined public health as a collective action for sustained population-wide health improvement. So collective action, meaning the community should be involved in the actions that brings about good health. It's not a one-person job, but the whole community should be involved in the prevention of diseases and growing people's lives. They should also participate in good practices that can bring about good health. Okay, so this is the first aspect, which is the definition of public health. Now we're going to differentiate. What is the difference between public health and clinical medicine? Because most of the people, they actually confuse between the two. They think public health and clinical medicine are the same. So we're going to look at public health as well as clinical medicine. Okay, so what is the difference between the two? If you look at public health focuses on the population. So the focus for public health is on the whole population. Then for clinical health, their focus is on an individual. Focus is on the individual. This means that when a person is sick, a clinical officer will look at an individual, what is the problem with the individual, examine the individual and give treatment to the individual. Whilst public health, we focus mainly on the population, the whole population. What is the problem with the population and how can we solve this population which is experiencing maybe a health problem. So you look at the population as a whole. The second difference is that public health focuses on health promotion and disease prevention and injury for the whole community. So it focuses on health promotion and disease prevention for the whole community. So it looks at the whole community. Their focus is on disease prevention, as well as health promotion for the whole community. But for clinical health, it focuses on the diagnosis, treatment and care of individual for the whole individual. So its focus is mainly on the individual. So they look at diagnosis, treatment, and care for the whole individual. So the focus is on the individual. That makes the two different. Okay. The third difference between public health and clinical health is that if you look at public health, it employs interventions aimed at the environment and the human behavior. So this one, it employs interventions so these interventions is for the environment and human behavior. Okay. Then for clinical health, it focuses on medical care. The emphasis is on medical care. Meaning when the person is sick, the doctor will emphasize more on the treatment, which is the medicine that person will take in order for the person to be cured from that particular disease. But for public health, our focus is mainly on the interventions that should affect both the environment and human behavior. So this makes this public health and clinical medicine to be different. They are not actually the same. So our focus, though we all deal with health matters, but our focus as public health is on the population, the whole population, and our aim is to look at the environment and the human behavior to prevent diseases. And if you look at public health, also it looks at problems before they actually occurs. So it prevents before the problem occurs. But whilst clinical medicine, it treats the disease which has already taken place. So these are some of the differences that we may actually focus on. Okay. We continue. Okay, now we're going to look at the functions of public health. What does public health do? As a public health specialist, what are you supposed to do? What will be your functions? Each one of us needs to know what the functions that you'll be dealing with. The first function of public health, as a public health specialist, you need to prevent epidemics. That is number one. You prevent epidemics. Okay, so by preventing epidemics, it means you're preventing before it actually occurs. For example, you know, if it's during the rain season, you start preparing. The drainages in the streets should be cleared, all the dead surroundings should be cleared so that you prevent diseases such as cholera. And also you make sure that you add chlorinated water you add chlorine to the water so that you drink treated water. So that is one way of preventing an epidemic. Then secondly, the second function we deals with promoting the health behavior. The function of a public health specialist is to promote healthy behavior. Okay, so you promote health behavior. Promoting health behavior, looking at someone who is doing exercises, you're promoting people to do exercises, you actually tell them to avoid alcohol abuse, drug abuse. All those are some of the ways in which you can promote healthy behavior. Then apart from that, you also monitor the health of the population. That is the function of a public health specialist. Monitoring the health of the community. Okay, so how do you monitor the health of the community? This can be done in various ways. You can do actually different types of assessments. You can either do a health status assessment, health impact assessment. These are some of the ways, or you can actually do a community diagnosis. Those are the ways in which you can monitor the health of the community. After doing that assessment, you'll be able to tell whether it is a health community or it is a sick community. Then another function of public health is that it develops policies to promote health. Develop policies to promote good health. So if you're promoting healthy policies, these policies should be made in such a way that they are productive, they are supporting good health in the communities in which you live, so that once you implement those policies, you should see a positive change in the community, so that that community will be a health community by the end of the day. Let's also look at another function, which is mobilizing community for action. It is another function. If we look back at the definition of public health, one of the emphasis was that it looks at the community organized actions. So whatever we do as public health specialists, we have to involve the community in our efforts to prevent diseases, in our efforts to prolong people's lives. So we need to mobilize the community for action. This should be good action. For example, we can put some bins. We can encourage people to actually be throwing the litter in the designated areas where there are bins instead of throwing litter anyhow. That way you are mobilizing the community for action. Then, though I may not exhaust all the points, the last one is response to disaster. So the function of public health specialists is to respond to disasters. This can be various disasters, they can be natural disasters, or they can be man-made disasters. For example, we had a recent disaster in Mozambique where there was heavy downpours and there were a lot of floods that were taking place there. So a lot of people were stranded because their homes were destroyed. So that is an example of a disaster. Another disaster can be earthquake. If an earthquake occurs in a certain country, it's a duty of public health specialists to respond to such cases so that there's a community action that can prevent the diseases that are occurring in that particular region which has been affected. So this is our topic for today. We'll end here.